Hey, welcome back to Not So Complicated, and today we are talking about Down syndrome, its causes, effects, management, right? So, just the introduction of Down syndrome is that it is trisomy of chromosome 21. The attached figure here is a figure of karyotyping, and you can see the encircled area, the 21 chromosome. There is trisomy, and there are a lot of reasons and mechanisms for this to happen. So it happens in one in every 700 births, and increased risk with increased maternal age, which is increasing these days. Like people get pregnant later in their life, like greater than 35 years of age, and that will lead to increase in Down syndrome. And that is why you are advised to be pregnant or do the delivery thing before you turn 32. So that is the safest time, right? So at most 32. And then the etiology and genetics is that there is trisomy 21, that is 47 chromosomes, and then it is due to three mechanisms. The first one is that non-disjunction, that is 95% cases, that will lead to full trisomy, and then Robertsonian translocation happens in 3 to 4% causing partial trisomy, and then the last is mosaicism. It happens in 1 to 2% and it will lead to mixed cells. The figure attached in here, the photo, that is a figure of a Down syndrome patient, right? And they all look similar for a reason that they have the same etiology and genetic features, right? So that is why they look similar. These are the clinical features. The first one that you have to remember is craniofacial, that is there is flat profile, upslanting features, and epicanthal folds, right? The other one is musculoskeletal, that is hypotonia happens and single palmar crease that will lead to sandal gap, and then cardiac is AVSD, then VSD, then ASD. These are congenital heart defects, that is holes in the hearts, and then neurological is that there will be intellectual disability, which in turn in later life will lead to the increased risk of Alzheimer's disease, and then brushfield spots are seen in like eyes kind of thing, and in hypothyroidism also. The diagnosis is done in different manners, like prenatal screening. There are three different things in the first trimester. What you do is the combined test, that is nuchal translucency in ultrasonography almost greater than 3 mm, and plus maternal serum markers like increased beta hcg or PAPPA, that is kind of indicative of Down syndrome. The other thing that we do in second trimester is quad screen, where we do alpha fetoprotein, SCG, human gonadotrophic hormone, and then estriol and inhibin A, right? And the other thing that we do is non-invasive prenatal testing, NIPT, and it is done cell-free fetal DNA. High sensitivity for trisomy 21 is indicative of Down syndrome. Then we have other tests, that is confirmatory tests right here. Confirmatory test is that you have to do chorionic villus sampling, CVS, in 10 to 13 weeks, or amniocentesis in 15 to 20 weeks for karyotyping, right? And then the other one is postnatal diagnosis. You have to compare the clinical features and the prompt karyotyping findings, right? And also translocation and mosaicism. The management is done in neonatal or infancy stage by, like in cardiac lesions, you do echocardiogram at birth, surgical repair for AVSD, VSD if they are severe by patch, right? And then thyroid, we have to screen for hypothyroidism at birth annually, and then hearing or vision, that is regular audiology, ophthalmology checks should be done. And then in developmental stages, we have to do the early intervention by physical or occupational speech therapy to address hypotonia and delays. And then in education, like individualized education plans, IEPs, so for intellectual disability should be done. And then the long-term features is that you have to monitor for leukemia, increased risk, obstructive sleep apnea, and celiac disease, and Alzheimer's prevention. You have to do cognitive stimulation and healthy lifestyle. The last one is family support, genetic counseling for recurrence rate recurrence can happen. 1% is for non-dysfunction, higher for translocation, and psychosocial support should be given for caregivers. So this is all about Down syndrome. Subscribe for more clinical polls like this. Thank you.